What is anemia? Anemia is when you have low levels of healthy red blood cells to carry oxygen throughout your body. Hello everyone, welcome back to today's video. I am Nesbola and my channel focuses on everything health and wellness. So if this is kind of content you are interested in, keep watching. Anemia can be life-threatening and it can be either mild or severe. Symptoms include fatigue, weakness, and feeling of short of breath. So what are the causes of anemia? Anemia occurs when the body doesn't make enough hemoglobin or red blood cells. And number two, if there's bleeding in cases of injury, accidents, or women with heavy period. And another reason is when the body destroys the red blood cells and the hemoglobin that is in them. The possible symptoms of anemia includes tiredness, weakness, shortness of breath, chest pain, pale or yellow skin, irregular heartbeats, headache, dizziness, fainting, cold hands and feet, frequent infection. So what are the different types of anemia and their causes? Aplastic anemia. This is when the body does not make enough new blood cells. This happens in cases of infections and to people with autoimmune disease and people that are too exposed to toxic chemicals and some people taking some certain medication. Iron deficiency anemia. This is the most common type of anemia. So this is when there is too little iron in the body. Sickle cell anemia. This is an inherited type of anemia. This is when an unusual hemoglobin forces the red blood cells into an unusual crescent shape called sickle. And then these irregular blood cells die too soon. It then causes an ongoing shortage of red blood cells. Vitamin deficiency anemia. Apart from iron, your body also needs folate and vitamin B12 to be able to make healthy red blood cells. So if your diet does not contain enough of this, it will be very difficult for your body to have enough healthy red blood cells. And also, there are some people that their body can't absorb vitamin B12. So this also can cause vitamin deficiency anemia. Hemolytic anemia, anemia linked to bone marrow, and anemias of the inflammation. So all these things can stop the red blood cell. So what are the factors that increases the risk of anemia? A diet that does not contain folate, vitamin B12, and iron. Menstrual periods, people that have heavy bleeding. Pregnancy, pregnant women who don't take multivitamins with folic acid and iron are at higher risk of anemia. Family history, like in case of sickle cell disease, which is inherited. Chronic disease, like people suffering from kidney disease. Age, people over the age of 65. Drinking too much alcohol, being exposed to toxic chemicals, taking certain medication. Other factors like a history of certain infections, blood diseases, autoimmune conditions. So all these are the factors that increases the risk of anemia. What are the complications of anemia? Anemia can cause serious health conditions if left untreated. Anemia can lead to severe tiredness, pregnancy complications, heart problems, organs damage, death. What are the diagnoses and tests required? You visit your healthcare provider and you'll be asked your symptoms. So you'll be taken to the medical laboratory for complete blood count test, CBC, or full blood count, FBC. So the prevention for anemia is you need a healthy diet that contains iron, folate, vitamin B12, and vitamin C. Ensure your diet contains green leafy vegetables, beef, fruit juices, peanuts, melon, tomato, pepper, strawberries, rice, beans, pasta, bread, dairy products, iron fortified cereals. So management and treatment of anemia. Your provider may recommend some supplements for anemia like iron, folic acid, and vitamin B12 supplements. Immunosuppressants may be recommended if you have anemia because of autoimmune disorder. And in some cases, your provider may recommend blood transfusion.